Connected by purpose, driven by passion. This is Children's Healthcare Canada's Spark Live webinar series.
Children's Healthcare Canada would like to thank our Keystone funding partners for their ongoing contributions that support all of our programs and activities, including this Spark Live weekly webinar series. Spark Live is where we gather each week to curate, convene, and showcase excellence and innovation from across the child and youth healthcare community. Our goal is to spark conversation, ideas, and action. There are two options to join in on the live conversation. Questions and comments for our panel or presenters can be typed into the question box, or comments that you want to share with the audience can be typed into the chat box and be visible to all of the attendees. For those of you on Twitter, tag @ChildHealthCan on any webinar-related tweets or use the hashtag SparkLive. And to keep up to date on all of Children's Healthcare Canada's webinars and other activities, be sure to sign up for our weekly Spark Bulletin by visiting our website at childhealthcan.ca.
Hello everyone, and welcome to another special edition of Children's Healthcare Canada's Spark Live webinar series. I am Paula Robeson, your host for the next hour. Children's Healthcare Canada acknowledges that our offices, located in Ottawa, are on the unceded, unsurrendered territory of the Algonquin and Anishinaabe people. We are grateful to have the opportunity to be present in this territory. Today, we're delighted to welcome Children's Healthcare Canada member, the IWK, for parenting in the COVID-19 pandemic. I'd like to extend a big thank you to ChildBright for sponsoring this session. The ChildBright Network, headquartered at the Research Institute of the McGill University Health Centre, is an innovative pan-Canadian network that aims to improve life outcomes for children with brain-based developmental disabilities and their families. As mentioned in the intro video, please type your questions into the question box at any time, and I'll pose the questions to our panel at the end of the session. Now I'd like to introduce our speakers. Lori Geske is first and foremost a mother. She's also a writer, lobbyist, workshop facilitator, and advisor on the federally funded Registered Disability Savings Program Helpline. Lori chairs the board of directors for FASD Society of BC, now 20 years in operation. Dr. Patrick McGrath is a clinical psychologist, scientist, senior health administrator, and social entrepreneur. He is currently Emeritus Professor of Psychiatry at Dalhousie University and scientist at the IWK Health Centre in Halifax, Nova Scotia. He's also chair of the board of Strongest Families Institute, clinician with CMAP Health, and founder of the CEO of 90 Second Health. At ChildBright, Dr. McGrath is the co-principal investigator of the Strongest Families Neurodevelopmental Program Research Project. It is my pleasure to pass the mic to Patrick.
Hello, very good to meet you today. So it's going to be myself and Lori talking to you about parenting in the COVID-19 pandemic, which we've all been in for so long, it seems like years, doesn't it? So Lori is a parent advisor, and she works very closely with us on the projects that we are doing with ChildBright. Lori?
Hi, Patrick. I'm pleased to be here.
So what we're going to share is we're going to talk about how scientists and psychologists think about parenting, and also about how parents think about parenting, and then discuss specific issues related to parenting neurodiverse children during the pandemic. We'll welcome your questions and comments. So the first thing is that we all have to acknowledge that I like to call it COVID fine. Actually, I stole that idea from one of my clients, and I asked her how she was doing, and she says, well, I'm COVID fine. And I thought that was so appropriate. None of us have been, all of us have been subjected to the difficulties with COVID, and it presents a lot of challenges, and we're going to have to accept that for most of us, we're okay. It's a good state, but it's not what it was before COVID, and maybe not after COVID. So in the context of COVID, families are under a lot of stress. There's dramatic changes of home life, the school, financial uncertainty. Many people are working at home, or they have to arrange childcare because they're not. there's fear of infection, there's isolation. People are piled up on top of each other, and we don't get as much relief from our family as we used to. And it's always a little bit chaotic. Everyone is more likely to be short-tempered. Laurie, did you have anything to add on that?
No, I agree with everything you've said. Here in British Columbia, our children with disabilities have not gone back to school. They are all at home, whether the parents want them there or not. Some do, but some want them back in school, and there's no provision for them yet because of the way the schools are opening here in this province. So I totally agree with all the stresses that you mentioned.
Yeah, and I think that we have to emphasize that for families with neurodiverse children, or many other families too with special needs kids or have special issues, they're having more stress than average. There's more difficulties, and it seems at times that some ways the opening of the schools, which has been a great relief to many families, has only added to the difficulties that parents of neurodiverse children have. So there's just fewer resources in terms of school, respite care. Medical care has been harder to get, and in some situations it's still harder to get. There's greater demands on parents, there's physical demands, the time, the emotional demands. And for some kids, there's difficulty in understanding the pandemic and its results. They don't really understand what's going on. And of course, many of our children are more susceptible either because of immunocompromise or because of lung problems. They're more susceptible to serious disease if they get sick.
Yeah, Patrick, I'd just like to add there are many adults with disabilities too who are unable to understand the pandemic in all but its very simplest terms, that now we don't have support workers coming to the house, and now you have to wear this mask when you go outside, but they don't understand why. And it can be very frightening, not just for children, but for adults with disabilities as well.
Absolutely. Absolutely. I think that unfortunately that hasn't reached the public awareness that the disability community in general, and I think in some ways children in particular, because of the school issues, have been particularly impacted by this.
I would agree.
So in parenting, I want to tell you a little bit about the most influential theory of parenting. And Diana Baumrind is the person who developed it. She was at UC Berkeley and for all of her career. And she came up with this idea that and she did a lot of research on it as well, that there are 3 styles of parenting. Now, people don't necessarily always fit into one style or another, but these styles have been very helpful for people to understand parenting. And there's the authoritarian parent, and that's, I am the parent, just do it because I said so. And I'm a little bit older than many, and I grew up in a family that was the way it is. My father laid down the law, that was the way it is. Very kindly, but it was because he was the parent, you did what you were told. A permissive style is let them be kids, and it's credited to Benjamin Spock, but he didn't really say that. But it's the whole idea that we shouldn't interfere with the normal development of kids, and we should just let them be. And then there's the authoritative parent who is firm, flexible, and warm. And the example I have on the slide is, let's clear the toys up before our story. So involving the children, clear expectations, but very warm. And in fact, other people have suggested that there's 2 different axes and one is warmth, and the other is behavior control, or how demanding you are. So The thing is that you can be authoritarian, and that's, as you see from that word cloud, some of the words that come up are strict, punitive, parent-centered, adherence to rules, or on the other side of it where you have low warmth and low expectations, you have uninvolved, lack of encouragement. And then over the other side there, you see the permissive, where lack of expectations. So not many demands placed on children, not much control, but a lot of warmth. And then the authoritative, where you have both high warmth and high expectations. And some of the words that are in that cloud are promotion of independence, assertiveness, supportive, balanced parenting, and having boundaries. So there are extra challenges among some people and others in parenting. One of the biggest one is small space, many people. When you have when you have a large house and not that many people and a big backyard, it's a lot easier to manage children. You tend to become more authoritarian, more negative when you have no space. Totally understandable. Kids are underfoot. There's no time. You have to be involved in the kids because they're right there. So there's no way of having any distance from them. If there's only one parent, that makes it more difficult too. Of course, it's easier than having two parents that are not at all agreeing and are fighting with each other. But in general, one parent, there's more demands. If there's a elderly family member, or if there's somebody immunocompromised in the family, or if the family members are working in essential services in healthcare or groceries, pharmacies, where they're in contact with the public, or they're first responders, or if somebody in the family has had COVID. These are all extra challenges, and they will affect parenting. So we wanted to start with some specific issues: establishing family rules, trying to move separate spaces, and as you can see, using positive discipline, punishment, family meals, be gentle with yourself, limit and monitor social media, and limit alcohol and recreational drugs. I know we're going to briefly go through those. Establishing family routines. It's really important to, as much as possible, establishing routines. The same routine every day makes it a little bit easier, but sometimes family needs, interfere and you have to change it. That's okay. But, wake up, breakfast, morning activities, break, continued activities. And especially if the kids aren't in school, you can see that if they're at school, then some of these are picked up naturally, lunch and so on. And it's a good idea, if you can, to post it, even in maybe with pictograms. If your child doesn't understand words, or in words, just post it so people know what's going on. Any comments on establishing family routines, Laurie?
Well, if parents are interested or forced into educating their kids at home, a routine is easy to establish for young children, where the parent follows these morning activities and this wake-up routine and actually is able to educate the child in just a couple of hours in the morning in the elementary grades. There's a little bit more work with older kids, and maybe a little bit more focus is necessary for kids with neurodevelopmental delays or disorders of one sort or another. But home education really fits in well with establishing family routines.
Right. The second thing is separate spaces. And as we mentioned before, it's much, much easier if you have a larger living space. If we can have quiet activities, for instance, I know many families that say, well, quiet activities are on the main floor. Anything rambunctious, you're in the basement. And depending on your child, they may or may not be able to do that. An office or an office space for mums and dads work, if they're working from home, is very helpful. Again, it may not be a separate room, but a separate part of a room. And outside, if you have access to the outside, especially before it gets much colder, is pretty good for some of the teaching. Most people, though, don't have much space, and so they have to be much more creative. And it's important that we recognize that it's a lot harder when you don't have the space. But you can use some things, the same space for different things at different times. So dining room table, school work in the morning, and quiet play in the afternoon, for example. Then dinner is going to be served there, and then maybe family games in the evening if that's suitable for your family. Have to be very conscious of safety and safety monitoring with some of our children, and so that oftentimes they can't be separated too much, and they have to be fairly close at hand so that you can monitor safety issues. The biggest issue and the hardest thing to do is to use positive discipline. It's a lot harder under COVID than it was before. It's because most of us are a bit crankier. It's harder to get things done. And this COVID has been going on for so long now. Some of us have been able to make it the new normal, but some of us are still having difficulty, or on some days we have difficulty. But a positive approach to parenting is always better. Rather than thinking of parent managing children, we want to think of parents encouraging children. And yes, there has to be some management, but positive words, positive gestures, they improve our own demeanor, and they certainly improve child behavior.
And sometimes it's just a matter of changing your focus. I had one of my kids was, well, he says now that he's an adult, he was ADHD. And so he was always moving. He was a kinesthetic learner. But I just learned that he could be jumping on the rebounder inside, or jumping on the trampoline, or running around in the backyard outside. And as long as he could hear me, he was listening. He just couldn't listen sitting down quietly beside me. And when there were those moments of, oh, this kid is bugging me to death, what am I going to do about it? It was an opportunity for me to, instead of railing at the kid, whichever child it was, to take a deep breath and recognize that my patience muscle was being flexed and I needed to strengthen it. And when I thought about strengthening my patience muscle, because you do get more patient if you exercise your patient muscle, then it was a good reminder that it isn't all on the kids, that I have to learn something from this situation too. And it stopped a lot of frustrated and angry words when I could realize that, no, it's my turn to exercise my patience muscle. The kid has been patient for long enough. He needs to run.
I really like that metaphor, the patient muscle. Another metaphor that some people use is the issue of what, looking at it from the brain perspective, what fires together, wires together. So the more you practice a behavior, the more likely it is to become part of a habit. So a patient approach is more likely to stay with you. Your muscle is being built up even in the brain, and it actually does rewire the brain. So it's very interesting that the positive to negative 5-to-1 rule has come up in child management and child parenting. It also comes up in marriage counseling. So it must be a good idea. And the idea is that to have every negative, you have at least 5 or maybe 10 positives. They have to be genuine, caring positives, though. They can't be just routine words that you say. And you can't have a negative tagline to it. So, for example, if you say, well, you did a great job, Bill, but, Why can't you always do it that way? That's not positive at all. That's very negative. And it has to be a positive that the child likes. Sometimes kids won't respond well to a positive that's spoken, but will respond well to a touch or a smile or just a change in your body posture. Those things are really important. The other thing is that it's so important, especially with kids that are really causing you some challenges, is not to sweat the small stuff. You've got to ignore minor misbehavior. So especially in these times when we're locked down or when we're in confined spaces, it's too easy to notice every little issue. It's too easy to get irritated by everything that your child is doing. So oftentimes behavior that if they were in the playground or out with their friends, we wouldn't even notice it. But, you know, when we're right on top of each other, we notice it. We're also tend to be a little bit more cranky. The kids may be a little bit more cranky. So it's really important to ignore minor misbehavior and not to sweat the small stuff. Because otherwise, you're going to end up on their case all the time.
And there goes the bank account of positive comments.
Absolutely.
The other thing about children being at home and they've been at school. So these are middle school kids or late elementary school kids with neurodiversities. These children have been molded into a system that they don't fit in order to attend a school setting to learn. So it's going to take time for them to throw off or slough off the stress of school. So that's why I don't say I was a homeschooler. I did initially, but for many years, I did not say I was a homeschooler because I didn't want.
Sorry, I lost your voice, Lori. So I'll just go ahead. The problem solving is one of the most.
Settle down.
Okay, good. We got your voice back.
Oh, darn. Yeah. I just was going to say that children who are neurodiverse and have been in school often are very stressed when they come out of school. And it can take several months to almost a whole school year for them to just kind of relax and be easier to deal with because of all the stress that they underwent to be educated in a school setting that their learning style didn't fit. So patience and those positive reinforcements are really important. And education is also important, but the relationship with your children is more important than their education in the short term.
So one of the most powerful tools we all have is to problem solve. We have to think of we have a situation that we're not happy with. We got to think of what the options are. Sometimes it's best to write them down. Sometimes it's best to brainstorm either with your kids or with somebody else. But it's always important to try small changes. Tweaking a system is a lot more likely to if you can make small changes, you're more likely to be able to maintain them. I like to always ask people to think of what are the unintended side effects. And sometimes you don't notice them at first, but be aware that there may be unintended side effects. You try something, you see if it works. And then if it doesn't work, you try something else. It may not always be the first solution that works. And that's not because you failed. That's simply because you haven't come up with the right solution the first time. Think of it more as an engineering issue, that you got to engineer things better and let the environment take a lot of the responsibility if you can, and try and make small changes, which is much more helpful. Now, one of the things that I feel very strongly about, and certainly the literature strongly supports that, is family meals. Over the last 20 or 30 years, family meals have become less popular, but eating together as a family is really a very good idea. You have to have a specific start time and finish time so kids know when it starts and know when it's finished. It used to be in the good old days, back in the last century, when I was a kid, we started meals at my parents' family with grace. Well, no, grace may not be the right way to do it now, but having a specific start is good. And then having a time when the meal is ended for everybody, and then some people may stay and may linger. So we used to be in terms of being excused from the table. The other thing is it is really important, as you see in caps there, no screens, no phones, no television going, no screens. And that has to be led by the parents, by the adults in the room. It should be a positive time, not noticing the good behavior is important, not a time to bring up difficulties. Make the discussion more child-focused if you can, and use open-ended questions like, well, Mary, what was the best thing that happened to you today? Or, any open-ended question rather than a question that can be answered with one word. Lori, do you have any comment on meals?
Well, yeah, I agree with what you've said on the slides there and what you've spoken as well, Pat. Meals are a great way to get kids talking and to give them the courage to express their opinions, to learn how to express their opinions in a safe environment. So I loved family meals when my kids were young. We even had special meals. Every once in a while, I would cook waffles and we'd have ice cream and berries on top of waffles, especially in the summertime when the berries were fresh here. And I would tell the kids that we were going to have this secret meal, and they couldn't tell their friends because the supper police would find out that we were having ice cream for dinner, not for dessert. And the supper police might come and do something awful in the household, like take the kids away because I fed them ice cream for supper. So it was a secret meal. And all my kids, just recently we were talking about it, and they all look back on those supper police meals that we had to be furtive about as such fun and good times, because we talked and we laughed and we had food that the kids liked, and well, I liked it too. And it was just really fun. So I think family meals are what you make of them, and you can make them into gold mines of memories.
Yeah, and they also convey values. You have a chance to chat, to convey values, which is the thing that is so good. I want you to invite me over when you have your next waffles and ice cream and not for breakfast, but for dinner.
For supper, okay.
For supper, okay.
Yeah, I'll do that.
Okay, so discipline. Sometimes discipline is seen as the major part of raising a kid, but it shouldn't be. We want to use discipline, especially physical discipline, very, very rarely. I would say never, if at all possible. But it's time out for kids over 3 years of age. I put it more as a time to calm down rather than any sort of punishment. How to think about how to do things better, having a kid in a boring place, and usually about a minute per year. So a 5-year-old would be maybe up to 5 minutes. And also you can use removal of privileges. One of the things that's important is to try and remove privileges only for a short period of time. If it's a month that somebody's lost privileges, they're never going to think about it, what it was that they lost their privileges for. And the other thing is you haven't got anything else to work with then for the rest of the month. And then you have to make sure it happens. There's no use in saying, well, you can't use you can't use your phone for 3 hours. You can't be look at any social media for this unless you enforce it.
Yeah, I totally agree.
The other thing is that the thing here in this slide is being gentle. We should be gentle with ourselves, recognizing that everyone makes mistakes. The only people that never make mistakes, they're not people, they're robots. We all make mistakes, and children are not overly harmed by 99.9% of the mistakes that we make. It's the entire experience that's important. So, you make a mistake, forgive yourself. With your partner, you want to make sure that you forgive them too and be gentle with them. You want to do unto others as you would have them do unto you. If you would like somebody to gently and quietly remind you if you have some problem, that's the way you should handle it with your partner. And with your child, there's going to be lots of ups and downs, especially in this COVID time. And you gotta remember that things will get better. You may be having a difficult day, but things will get better. Really try and keep that 5-to-1 rule into effect. The other thing is, when you're bringing up anything that's negative, make sure that you have a slow startup, and you start with some slow introduction to the topic. It can, oftentimes that's best if it's something that is positive, like, you're very good at dealing with your little brother who's a little bit of a pest at times. And I noticed that this morning, though, you were really very harsh. So but having a slow startup is a lot easier for people to take criticism. And again, these ideas come from the parenting literature, but they're also in the marriage literature. And when you want to raise an issue with your partner, it's always better to have a slow startup. And we want to talk a little bit about self-care. Now, if you have a couple of kids, you probably say to yourself, self-care, who has the time? I don't have any time. I don't have a minute. And with COVID, it's just impossible. But if you think of self-care as coming in very small doses at times, and when we have young kids, when we have a lot of demands, it's going to have to come in small doses. But we have to have those small doses. Maybe a minute alone, a short walk, a quiet coffee. You have to have these things, even if they're only in very small doses, because you don't have much time. Each day, you need that to strengthen you. I know my mother, she had 10 kids. There were 10 of us. And what she did was she loved to iron. And for her, I mean, I don't know how anybody would love to iron, but she loved it because we had to stay away because the iron was hot. And she'd often do it watching one of her soap operas on television. And everybody knew that you stayed away from mom when she was ironing and she was watching her soap operas. So that was her self-care. Lori, do you have any tips on self-care?
Well, yeah, self-care sometimes can happen with the kids around. Maybe your self-care is sketching or painting or drawing. And you can do that with the kids around you if they know that this is 5 minutes, we're going to do this, and we're going to be quiet. You're not going to talk to me. I'm painting as well, and we're all just painting or coloring together. And if that for you is something that is of interest and it's relaxing, then you can consider that self-care as well.
I think that's a really important point. There's no definition of what self-care is other than something that you find rewarding and relaxing. That's what self-care is. And you have to have some of that. I don't care how demanding the situation is, you need that even in small doses every day.
Mm-hmm.
The limiting and monitoring of social media, again, this is true in all parenting, especially true under COVID and then more true than in the pre-pandemic times. You should be monitoring what the kids are looking at. Some of that can be done electronically to restrict their access to certain types of material, but it's important that parents establish early on, very early on, that that's the rule in our house. In our family, parents know what their kids are watching, what they're looking at, what they're doing. That's our rule. And if you do it early on and it's just routine, it's a lot easier. It's not a matter of civil rights, not a matter that kids I have the right to have my own privacy. That's not the case. This is in a family. These are kids. Now, when your kid becomes 16 or 17 or 15 or 16 or 17, you're going to loosen that. You're going to change that. Maybe you start that when they start to become, when they're 12 or 13. But in general, the principle should be established very early on that parents have the right to know what their kids are looking at, what they're doing.
I think everything that we allow our kids access to has to be thought about and done deliberately. So I look at all of the research, for example, around cell phones and children's skulls and brain maturation and the electromagnetic frequencies that come off of cell phones. And when my kids were little, there weren't cell phones, but if I had little kids now, they would not own cell phones until they were at least in their late teens. If they could afford to buy one, then maybe they were old enough by then. But it wouldn't be a toy that I'd give to a young child to play with because they're just not healthy to have around a growing brain. So for me, as a mother, I made all of those decisions really deliberately and thoughtfully. And I looked at all the research on all sides of the matter and made my own decision about whether my kids were going to have cell phones. And the youngest was young when cell phones became popular. And she didn't get a cell phone like all the rest of her friends when she finally went to school in grade 10. She didn't have a cell phone. She didn't have one until she was in grade 12. And it's only because she bought it that she got it.
And each family has to establish what works for them. And I think that it's really important that the family values be discussed and the family values be clear. But the bottom line is that limiting and monitoring social media is good for kids.
Yes.
Now, something that most people are quite distressed about in the mental health and addictions area is that under COVID, the actual amount of excessive drinking or use of recreational drugs has increased. And some studies have shown that the number of people who are using alcohol and drugs to relax, to overcome their stress has doubled, and overusing drugs has doubled. It's very easy when stress is building to use alcohol or drugs to relax. It feels good in the moment, but very often then it will disturb your sleep. It impairs your judgment, and it's not very healthy. So if you've increased your alcohol or drug use during COVID, it's something you should really consider changing. And again, if you change it in a small way each week, try. So maybe I'm drinking too much. I'll reduce that maybe I'm not going to go cold turkey. For some people that works, but trying to reduce their alcohol or drug use. It's a lot easier, of course, if you don't have it in the house. And it's a lot easier if you can think of some other way to reduce your stress. It's very easy to overuse drugs and alcohol. And as I said, under COVID, under the pandemic, that has increased dramatically. You're more likely to lose your skills. You're not thinking as clearly, more likely to get angry, more likely to be depressed. I mean, alcohol in particular is a specific depressant, and you're more likely to have poor sleep. You may fall asleep easier, but then you're going to wake up in the middle of the night and have difficulty getting back to sleep.
and think about how it's going to affect your children when they grow up. Are they going to resort to drugs or alcohol when they're stressed? And what will that do for their relationships?
Yeah, and this is a tough one because it's something that it's hard to change, but it's possible to change. It's possible to change that, you know, and get back into control on that.
Mm-hmm.
That's the general discussion that we had. We have about 15 minutes now for questions and answers, but I want to tell you about 2 studies that we're doing. And these are both funded by Canadian Institutes of Health Research through ChildBright. One is the Life Beyond Trauma study, and this is actually a study of PTSD in parents of kids with neurodiverse kids. And this is ongoing right now, and we're now enrolling participants in that study, and it's all by distance, so it doesn't matter wherever you are in Canada. And my research group at the IWK is running that, and we have had a lot of good response, but we do have more space in that study. And the second study is the Strongest Families Neurodevelopmental Study. And again, that is ongoing, and we've enrolled hundreds of parents in it. And these are both randomized trials in which you may either be in a group that receives the intervention right away, or maybe later. And we're looking at different ways of helping families manage their children's behavior. And we have telephone coaching in that one, and self-management and parent-to-parent connections are really important in that trial. You can, I think in the chat room they have some access to the exact URLs and how to get a hold of us. There they are, right there. So the Life Beyond Trauma study, lifebeyondtrauma.ca, and the Strongest Families Neurodevelopmental Study, crfh.ca/neuro. Okay. Questions or comments?
Thank you so much, Patrick and Lori. We've got a number of comments, but no questions. I'm going to take this time to encourage all panelists and attendees to type any questions you have in the question box, and we'll address them now. While people are taking some time to type, I will share some of the comments.
And maybe we can respond to some of them.
Absolutely. Bibiana suggested she likes the idea of working with your kids to come up with solutions rather than managing them.
Absolutely. And I think the involvement of the kids in problem solving and coming up with the solutions, you know, it's a little bit more difficult if the kid is either, you know, is depending on how the cognitive functioning is, or a very young child. But it's not a matter of an autocracy. And that goes right back to our talking about the authoritative parent who listens to the kid's concerns, who manages with the child, not on the child. And so I forgive me if I've used language that might not have been clear enough in that.
Bibiana also noticed that there's lots of resources on parenting smaller children, but not so much for adolescents and older kids. Do you have any resources you can point her to?
I don't have a specific resource at the tip of my tongue right now. I do think that the same principles are involved. And with older kids, of course, the working with your child is even more critical. Lori, do you have any suggestions for resources for adolescents?
Yeah, parenting teenagers and bringing them home from school and educating them in the home is more difficult because they've been molded into what they needed to be to learn in a group learning environment. at a public or private school. So these kids often will need months to kind of relax and quit stressing out, and the behaviors will slow down and become further apart, and you'll see who your child really is and get to know them and be able to share your values with them on a more reasonable level. For older teens, 13 to 16 or 17 even, these kids benefit from textbooks for math and possibly for biology, chemistry, and physics. But those were the only textbooks that I ever used with my kids, and I educated them at home for 20 years. The last one went to school in grade 10 because there was nobody else around because the older kids were gone.
And there are a lot of good resources on the web, and they all say much of the same thing. The thing is that the most important thing is when you're dealing with teens is that you're going to have to try and really do this authoritative parenting, where you're going to be consulting with your kid. There's really important to establish reasonable expectations and to set some rules or consequences, but avoiding ultimatums. It's really hard to make sure that you're not doing that, but it's a matter of trying to explain your decisions, of trying to be reasonable, listening to what they're bringing up, but at the same time, the parents have to take control of the situation and be ultimately responsible. So it's not merging into the more situation where you have you say, well, they're a teenager now, they make their own decisions. No, it's a matter of that as they demonstrate more responsibility, you're going to give them more freedom. And if they show very poor judgment, you're going to have to impose more restrictions just to keep them safe. The positive example that you're showing, and this comes up all over the place, if you're telling your teen that they shouldn't be smoking and drinking, smoking dope or drinking, and you're smoking dope and drinking, it's going to be pretty hard to implement those types of rules. The other thing is that, you know, if you're telling your kid not to talk back, not to be rude, then you should be kind and considerate and not be rude to your child. So it's really a matter of shifting using the same general principles.
Yeah, and with regard to internet resources, also there are bchomeLearners.ca, and there's probably a home educating organization in every province across Canada and in the territories. But if not, you can start with bchomeLearners.ca and talk to parents who are educating at home, and find parents who are educating kids your age or the age of your kids at home and what they're doing. And maybe there's opportunity to go on field trips together one day a week or once a month. And there's all kinds of ways that our kids can learn at home that they would never have the opportunity to do in a school setting, because it's just too high a ratio of 1 to 25 or one teacher to 30 kids. You're going to be 1-on-1 or 1-to-2 or 1-to-4. And so you're going to know your kids and know how much work that they need to do in a certain area to bring them up to what you consider a passable competency for their age. And just because they're 17, if they're not neurodiverse, doesn't mean they're going to be doing grade 11 work or grade 12 work. These kids tend to mature later, so their prime learning years go from 18 to 25. And I have found with my daughter with neurodiversities. She has language disorder, and she's still learning at 35 and making amazing progress. When she was 20, we couldn't imagine that she would ever have the competencies that she has today. So don't ever give up on your kids, and don't let parents you talk to give up on their dreams for their children's future.
Other comments, or perhaps you can give us some more questions?
Sure. Jen comments that she feels it's important to remember that some of the families we support are in survival mode even before COVID. Consequently, children have been home during even higher stress times and possibly exposed to what she's referring to as toxic stress in terms of domestic violence or lack of food or housing security. And building on that, for the most stressed families, what's the best first step or the most important step you would like families to start with?
I completely concur with the challenges that many families are experiencing. They went into the pandemic without the resources, either the interpersonal or the skill resources, and then they're hit with the pandemic where they have fewer resources to draw on, and they're more in more difficult situations. I think when working with those types of families, and families in that situation, rather than, they're not a specific type, but in working with families in that situation, I think it's important to be supportive and to find areas that you can support with those families. I don't think there's each family is different, but you have to find areas to support the family on. It's always better to build on positives than to focus on negatives. So I guess if I had to choose, I would use that 5-to-1 rule. Find the positives, find the areas where somebody is doing better, is managing, and really try and encourage that and support that. It's pretty tough though. It's because the people that have been hit hardest by COVID are people who were having difficulty before.
And what advice do you have for families who, like many of us, are struggling to see an end of times to this, and perhaps reframing that this is with us, that the virus itself will be with us for a while, and we have to sort of not wait until it all goes away to get back to whatever this new normal, I'm not sure I like that term, but hopefully a bigger and better way of doing things. But what advice do you have for families for the long haul?
I think exactly what you said. You put it very well. We have to begin to reframe the situation is not that this is not a short-term crisis. This is a long-term condition. And we have to begin to accept that things are going to be different and figure out how we can manage in that situation. So a bit of acceptance that it's here. We can't wait till it's over, because it may not be over in 6 months or a year, and there may be other issues that come up that are similar. But I think an acceptance of the fact that these are a different type of situations. The world has changed with COVID, and unfortunately, the world has changed for some families much, much more than others, and they have to think of, okay, this is, it's not the time to think that it's going to be over soon. How am I going to manage for the next 6 months, year, 2 years, 3 years, and so on? So I think you have to begin to reframe it as a long-term situation that will get better, and then maybe it get worse, and it will. And we have to think of longer-term solutions. We can't just wait it out.
And some of the resources you shared are at the IWK. Are there similar programs for kids across the country?
The two studies that we mentioned are for kids across the country, or for families across the country. These are national studies that we're doing. And as long as you're in Canada, living in Canada, then you're eligible for those studies. And that's the beauty of, because they're all telehealth or e-health types of studies. That's what my research group does. The other thing that I would note to you is that Strongest Families and the Strongest Families Institute offers parenting help for kids with different types of problems through their coalition with the different provincial governments and other agencies. So you can go to the Strongest Families website and find out where that's available. Unfortunately, it's not available in every jurisdiction or every place in Canada, but it's available across Canada and the territories. In Northwest Territories, we have a very strong program there in different areas of the prairies and Alberta and the prairies, and in some areas of Ontario and Quebec, and then in the Maritimes.
Wonderful. That is the last of our questions, but I want to thank you so much for your willingness to share your time and expertise with us today, both you, Patrick, and Lori, and Karen for doing some really great work on the chat line in the background. Thank you also to all of our members and other attendees for spending this time with us, and we hope you depart with some practical knowledge to bring back home or to your organization. As a reminder, please complete the Child Bright evaluation form, which the link to which is now in the chat box. We have a very packed fall agenda for our Spark Live webinar schedule. Tomorrow, even just this week, tomorrow on the 23rd of September at 11, our usual Spark webinar spot, we're hosting Evaluating Factors That Matter for the Sustainability of Large-Scale Improvement Initiatives using Lean in Pediatric Healthcare in Saskatchewan. And on Friday, September 24th, we're hosting folks from BC Children's Hospital who will be presenting their work on the new Swish and Spit COVID test and respond to your questions. On next week, on Tuesday, the 29th at noon, we'll be hosting another special COVID edition of Spark Live, More Than Medical, supporting NICU families with their transition home during a pandemic. And there's more. To stay up to date on all Spark webinars and other events and activities, visit our website to sign up for Children's Healthcare Canada's Spark newsletter and follow us on Twitter at ChildHealthCan if you haven't already done so. As well, registration is now open for our annual conference in November, taking place virtually. To register, visit our website at childrenshealthcarecanada.ca. It's always great if you can watch live, as your questions and comments really enrich the discussion. But if you can't watch live, the recordings to these sessions are made available after the fact on our Knowledge Exchange network. So thanks again for joining us today. Thanks to Patrick and Lori for supporting our webinar program, as well as for Child Bright for sponsoring this particular webinar. And hopefully we'll see many of you back here tomorrow. Bye, everyone.